is Mika. I am a Health Data Analyst and graduate student in Epidemiology at the University of Hawaiʻi at Mānoa. These days, my favorite physical activities are often limited to walking my dog and playing with the kids, and vice versa. I was born in Salt Lake City, Utah, but moved to Honolulu when I was very young, so Hawaii really is my one and only home. And my main role in the public health resonance project has been to analyze data from a survey put out in 2022, in which we ask a panel of about 1,000 adults living in Hawaii to reflect on their past engagement in 4 physical activities across their lifespan. And these activities were hula, outrigger canoe paddling, spearfishing, and surfing. Having lived the majority of my life here from elementary school to now, I can tell you that these activities are strongly connected to the people of Hawaii. Growing up here, it is impossible not to know somebody engaged in at least one of these things. There's huge high school paddling teams. Hula is practiced across all ages. And to some, surfing and spearfishing are just a way of life. Also, most of these activities originated here, and as such are deeply ingrained in both our histories and our culture. The survey also collected some additional contextual factors, demographics, other health-related factors, and I'm really excited to present some of the key highlights from this work. Next slide, please. So what we've found so far is that about 70% of survey respondents had engaged in at least one of these 4 activities at some point in their life. Hula was the most common at 45%, but followed really closely by surfing, spearfishing, and then paddling. Looking at the Venn diagram on the right, we can see how lifetime engagement overlaps within individuals. The main thing I want to highlight, though, is that most engaged in multiple activities. They didn't just stick to one thing, with over 12% of the panel participating in all 4 activities at various points in their life. Engagement was significantly higher among Native Hawaiians and other Pacific Islanders, and also in more rural parts of our state, such as Hawaii Island. Women were more likely to engage in hula, and men were more likely to engage in spearfishing and surfing. There were no gender differences for paddling. Next slide, please. So turning now to trajectories of engagement for the sake of brevity, I use hula as an example, but trends were mostly similar across the other 3 activities. The basic takeaway being that participation is highest in childhood and then gradually drops down to the lowest proportions in older adulthood. However, spearfishing was a little bit different, where engagement was actually highest in early and middle adulthood. Another interesting trend we observed here was that past participation seemed to differ based on the respondent's current age. For example, older adults did not retroactively report childhood engagement as frequently as younger and middle adults. And this possibly suggests some sort of a period or cohort effect. Next slide, please. So using their current age and the age of engagement, we're able to further investigate historical trends for participation, specifically for childhood and early adulthood engagement. For example, for hula, we see a large increase in childhood participation, sometime around the 1960s, 1970s. And this really corresponds with the cultural revitalization movement in Hawaii that started around that time and continues to today. We see similar but more gradual trends for paddling and surfing, while spearfishing seems to follow a different trajectory entirely, with childhood and early adult participation remaining somewhat stable, only slightly increasing. Next slide, please. So those are just a few highlights of the trends we've observed so far. We are currently in the process of drafting a manuscript for publication to hopefully share out the full results of this work. I am hopeful that work like this can help programs meet people where they're at to better understand how to best capture and improve the health and health-related behaviors of our people, and especially here in Hawaii. My time, so you can see my email on the slide if you'd like to discuss beyond this webinar, and thank you all so much for your time.